Yeah, I think you're right. I think a lot of Democrats across the country would then think that, oh, here's a viable playbook. The Democratic Socialists, Sandy Cortez, Bernie Sanders playbook. I should embrace that.
Yeah. Well, speaking of AOC
Sandy,
and Bernie, they did a town hall on healthcare recently.
Sandy Cortez, bartender.
Yeah.
Hi. On the issue of healthcare, a lot of the clinics and hospitals that are negatively affected the most under the One Big Beautiful Bill are located in rural, mostly Republican areas. A lot of the increases in Affordable Care Act premiums that Democrats are fighting to prevent are concentrated in more rural Republican areas. If the Republicans are so insistent on sticking it to their own voters on this issue, why don't the Democrats just let them?
Mm-hmm. I mean, I think Alexandria touched on this before, and that is, we are, one of the things, and this really annoys me about Trump, he's dividing this country. Why would I not? When we hit the road, we were in Idaho, right? Mm-hmm. It's the most conservative state in America, I think. We had many thousands of people coming out. We are Americans. Mm-hmm. What, you think I would feel okay if somebody in a Republican state died because they couldn't get health care? I would hope not. I would hope nobody feels that way.
And I think it also speaks to a big difference between someone like Trump and someone like me or someone like Bernie, which is that Trump believes that if you don't vote for him, he doesn't have to be your leader. That if you didn't vote for him, that you don't deserve good things to happen to you. I don't care if someone voted for me or not. I don't care if someone is a Republican or an independent or a Democrat. I don't care if someone likes me or not. That will never change the fact that I'm going to fight for them to have health care. I want MAGA to have health care. I want MAGA to be paid a living wage. But he doesn't want people who are Democrats, or he doesn't want people based on their political affiliation to benefit. And that is the difference between a strongman and an authoritarian and a leader of a democracy.
Sandy.
So it's just,
Sandy, baby.
It's false on its face by evidence of the fact that Donald Trump has done tremendous work in appealing to Hispanics, African Americans, people who don't typically vote for him or support him. I mean, he's gone out of his way to do things to help them.
He brought in an icon of the Democratic Party, an RFK Jr., to work on something that should be bipartisan for everyone.
It literally saves lives.
It literally saves lives. If you want to talk about health care, if you want to talk about the health of America, Donald Trump brought on JFK Jr. to fix our healthcare system from the standpoint of all the additives and preservatives and junk that's in our food system, to take on big pharma, to take on the food industrial complex.
Yeah.
But also they're talking about these subsidies. Ladies and gentlemen, I would suggest you go to the Wall Street Journal this morning. It was actually published yesterday. Read an article by Chris Jacobs, who was the intern at the Jefferson Group from our friend John Desser back in the day, and has created a nice consulting business for himself, where he talks about how the whole thing about these subsidies is a complete lie.
Yeah.
The Democrats arbitrarily raised these subsidies, these Obamacare subsidies, to people making 450% of the poverty level and to pay for 85% of their premium. You know what that drops down to in December? 75%.
Right. Yeah.
75%.
Well, I mean,
it's pennies on the dollar that you would think that the sky is falling, and it's not. It's a complete total lie.
Keep in mind, it was the Democrats who made this a temporary program.
The Democrats are proving that Obamacare, the Affordable Care Act, is neither affordable nor care.
Yeah, exactly.
It's an act.
Yeah, that's about all it is.
But that's all it is.
It's an act.
And the only way to keep it going is to pump more money to it and put more and more people who are able to pay for their own health care into the system.
Well, and when AOC says that she wants MAGA to have health care, she wants MAGA to have government-run health care.
yeah.
I mean, Bernie wants, they make no mistake, they don't want you to have freedom in healthcare. They want you to be on a government plan.
Yeah, they don't want you to have more choices,
No.
to take responsibility for those choices in healthcare, to be able to look at pricing and pay for what you need. They want the government to take over the whole thing, which means less choice, more rationing, less care.
Yeah. I mean, she talks about, oh, that's a strongman authoritarian. No, they're the strongmen and authoritarians because they're the ones who want government command and control.
Yes.
They want government to set wages. They want government to set prices. They want government to control healthcare. They want government to control housing. I mean, this is not they don't engage in a legitimate debate
No.
about freedom.
No, when it comes to the left, like Sandy Cortez and Bernie Sanders, they want dependency. They don't want opportunity.
That's right.